Anatomy of the eye. The eye is the organ of sight. It helps focus light and convert it into a signal that can be received by the brain. Let's take a closer look at the main parts of the eye. The sclera and the cornea compose the eye's exterior. The sclera is a protective layer of white tissue. The cornea is the clear window in the front of the eye. It helps focus incoming light. When you look through the cornea, you can see the iris. This is the colored muscle that contracts and relaxes to regulate the amount of light that enters the eye. The opening in the center of the iris is called the pupil. After light passes through the pupil, it reaches the lens. This flexible, disc-shaped structure allows the eye to focus light. Tiny strands called zonular fibers attach to the lens capsule. They connect to the ciliary muscle, which contracts and relaxes to control the shape of the lens. After light passes through the lens, it strikes the retina. This thin layer of light-sensitive tissue covers the back of the eye's interior. The small central portion, called the macula, is responsible for detailed vision. In the center of the macula is a small dimple called the fovea. It contains the highest concentration of light-sensitive cells. The retina is nourished by blood vessels in an underlying layer of tissue called the choroid. The retina converts light signals into electrical impulses. These travel to the brain through the optic nerve. The area where the optic nerve attaches to the retina lacks light-sensitive cells. It is called the optic disc and is the eye's blind spot. The central artery and vein of the retina are bundled with the optic nerve. The branches of these vessels carry blood to and from the retina's inner surface. The interior of the eye is divided into three chambers: the anterior, the posterior, and the vitreous. The anterior chamber and the posterior chambers are filled with a thin, clear fluid called aqueous humor. The vitreous chamber is filled with a thicker fluid called vitreous humor. It helps the eye keep its shape. The eye is one of the most complex and delicate organs in the body. In a healthy eye, the many parts work in harmony to give us the sense of sight. Conjunctivitis, pink eye. This is a swelling or an inflammation of the conjunctiva, a thin, clear layer of tissue in the eye. The conjunctiva covers the white part of your eye and also the inner side of your eyelids. Most often, conjunctivitis is caused by a viral or a bacterial infection, but it can also be caused by an allergic reaction. Things like pets, pollen, or mold can trigger it. Conjunctivitis can be caused by irritants such as smoke or chemical fumes, and it can be caused by contact lenses. Symptoms of conjunctivitis can include pain, itching, and redness. Symptoms may affect one or both eyes. Your vision may blur, and bright light may hurt. Your eyes may feel gritty. They may be watery. Crust may form on your eyelids when you sleep. Treatment options depend on the cause of your conjunctivitis. You may benefit from medicated eye drops. Cool compresses may help. You may also need to avoid things that irritate your eyes. Your healthcare provider can create a care plan that is right for you.
LASIK eye surgery. This improves vision by reshaping your eye's cornea. That's the clear outer layer at the front of your eye. LASIK can treat nearsightedness, farsightedness, and astigmatism. When it's time for your surgery, you're given medicine to help you relax. Drops numb your eye. Your eyelids are held open to keep you from blinking. A suction ring is placed on your eye. Then, the doctor carefully opens a small flap of tissue in the front of your eye. That exposes the part of your cornea that will be reshaped. The doctor reshapes your cornea with a computer-controlled laser. Its new shape will help the cornea focus light properly. Then, the flap is folded back over the front of your eye. It will heal naturally. After the procedure, your eye may be itchy and watery. It may burn. Your vision may be blurry. You'll use medicated eye drops as it heals. You'll have follow-up appointments to check your vision. Follow your doctor's care plan. Laser photocoagulation. This procedure uses a laser to treat the inside of your eye. It can shrink or destroy abnormal tissues and blood vessels. It can also create tiny spots of scar tissue to repair a detached retina. To begin, drops put in your eye dilate your pupil. Your eye may be numbed. A special contact lens is then put on your eye. The lens helps aim the laser. The doctor shines a laser into your eye. When it's turned on, you'll see flashes of light. Your treatment may require only a few flashes, or you may need hundreds. After the procedure, your vision will be blurry. You may see floaters in your eye. Your doctor will give you tips to help your recovery.